So in Massachusetts, we have 351 cities and towns. 190 communities are actually doing doing the program on their own. Here in Arlington, we feel that it is our duty to serve our community. We have the capacity. We have the ability and the staff and the volunteers that are able and ready to be dispatched to do this work. So we've really just been able to shift our focus to providing this service to our highest risk residents, in the homes.
In-home vaccinations are available for people who are not able to leave their homes and go to a vaccination site. The state defines homebound people by the following criteria: individuals who have considerable difficulty and/or require significant support to leave the home for medical appointments, require ambulance or two-person assistance to leave the home, or are not able to leave the home for medical appointments under normal circumstances. Arlington residents who meet one of these eligibility requirements, regardless of age, can make appointments by calling Arlington's Council on Aging. Director of Health and Human Services, Christine Bongiorno, lays out the town's homebound vaccination operations.
And we have been assembling our list. So we do vaccinations in the community every year for the flu vaccination program. So we obviously built off of that list, the list of persons we would be vaccinating for COVID. And we also then were able to, through the state program, identify additional people that were in need of support. So we've actually come up with, come across a lot of people in our community. So we have up to 100 now that are on our list that will be going out next week once we receive the vaccine to vaccinate. And there are people under 60 on that list. People that have severe issues that really prevent them from leaving their home and to getting to any mass vaccination site.
The town will utilize staff and the nurses within their team, as well as collaborating with the Arlington Fire Department, EMT services, and other departments to deliver and administer the vaccines at your home.
So in our office in Arlington, we have a health and human services model. So we work as a team with the Council on Aging, the Health Department, Veteran Services, and our counseling center. And so we have a lot of connections with our community members that are most in need and at risk. So all of the staff in those departments will be participating as well.
Scheduling an in-house vaccination appointment for COVID-19 is easier than most people think. Here's Christine Bongiorno with a simple explanation of how to schedule an appointment.
There's really no application process. We, if someone identifies as someone that's a homebound resident, we go through the 3 categories with them on the phone just to ensure that we're screening people. But there's really no application. They don't need to approve with forms or anything like that. We don't want to make this difficult for people.
For those already on the list for an in-home vaccination appointment and who have been waiting for a number of months to receive their shot, Christine Bongiorno says the shipment of vaccines is arriving in the first week of April. When that happens, the vaccinations will start immediately. So we're looking at around Wednesday, April 7th to go full throttle, and the speed is really dependent on the state's supplies and allocation of resources. The COVID vaccines will be the Johnson & Johnson version, and the homebound program will run for as long as it needs to. For ACMI News, I'm Anim Osmani.